How is cystic fibrosis diagnosed?
There is no such classification, but as I highlighted, the clinical features are variable as per the age. And in the beginning, it may be just a simple wet cough, and at age of 20 years, there may be significant expectoration or phlegm along with that breathlessness or breathing difficulty. So that's why, though they are very variable clinical manifestation, and a physician should be aware about it. And it may be one is because of the poorly managed respiratory passage and digestion in the beginning, or it may be because of the different type of genetic defect. I had discussed about pathogenesis, that there is a increased sodium and potassium in sweat. So we take that for the making a diagnosis. So we do a sweat test, estimate the chloride content in the sweat, and if it is more than 60 milliequivalent, along with clinical features, we are sure that we are dealing with cystic fibrosis. Other thing which we can do is identification of two mutations. Mutation is defect in the gene, genetic material. And if we can identify two, and I would like to clarify that since it is a autosomal recessively inherited disease, that indicates that the one gene is coming up, defective gene is coming from the mother, and another one is from the father. So because these two are together, that's why that is responsible for the disease, development of disease. And there are multiple defects in the gene. And this is another test, that you test the gene, and if you are able to identify two defects in the blood sample, then you are 100% sure that it is a cystic fibrosis. Problem here is that there are more than 2000 type of mutations or defect. Out of that, some of them are responsible for causing disease. That's why it is very difficult to test. For India, we say that sweat chloride or increased chloride in the sweat with a clinical phenotype are considered to be a gold standard for making a diagnosis. Another thing, as you were worried about how parents can decide that whether my child needs investigation for cystic fibrosis, is that at AIIMS, we developed a test that is called aquagenic wrinkling, in which just let me explain that what is aquagenic wrinkling. If I put my hand in water, after 10-15 minutes, it will show some wrinkling on my palm and as well as my uh, uh, these thing digits. So the children with cystic fibrosis, they develop this wrinkling within 3 minutes. Almost 81% of the children may develop early wrinkling, but it may be due to cystic fibrosis as well as due to multiple other causes. So this can be used as a, if the child is having a recurrent pneumonia, not growing well, and if parents notice that there is a very early wrinkling as compared to the other sibling, then it may be indicative of a cystic fibrosis.